So we are going to start with a Statehouse update, letting you know what's going on down at the Statehouse. Mostly everything that's going on right now is actually the budget. The budget is overtaking everything and everyone. There are a couple of hearings going on for different bills, but nothing really pertaining to what we to the subject areas that we care about. It is, it's budget, it's some Medicaid issues, those types of things. So, but in June we are going to go back to. There's going to be some bills that are on the horizon that that will definitely get looked at. First off, I wanted to update everyone. House Bill 47, which was the refreshment areas, which would exempt townships and these refreshment areas with more than 25,000 people. It's a half-mile by half-mile area. They actually passed that law. It is now law in the state of Ohio. Right now there has to be, these can happen in cities, so Cincinnati, Dayton, Youngstown, Cleveland, Toledo, Columbus, and the more the metropolitan areas can actually create these districts. Canton and Akron are other cities that have that can have these as well. And what it does is it allows folks to be able to carry open containers in these areas. There's already been an outcry from Dayton, actually the city of Dayton, to how they're going to manage this, that they do believe that it will bring in tourism dollars, but they are worried about people, the public drunkenness, how businesses are concerned about how they will be responsible or deemed responsible for folks if they sell to someone and the person is, gets intoxicated, gets into an accident, or has some kind of mishap. Then how do they enforce that? But now it's law. It is something that that folks, cities are going to have to take into account now. In 2 years, they're actually going to expand that into more rural areas. Again, if there's more than 25,000 people, rural entities will be able to create these refreshment areas. But again, that's 2 years down the line. The other piece that that was added late in this bill was a piece about pedal carts, which basically are these. They're kind of moving bars. They are. You pedal. You get on these things, these bars, and you pedal. People who are sitting there pay $25, $35. You pedal the cart, and you can actually drink on these things. And these were actually thrown in to be legalized in the state as well. So amongst these areas, you can now have these these businesses where you pay so much money, you pedal your little cart around, and you can see the sights, I guess, while you're drinking and pedaling your bicycle or your big pedal cart. I know Derek's trying to get a picture of it here as I'm talking about it, and and this is the picture that Derek pulled up is exactly what it looks like. So the patrons sit there on those seats, and there's a bartender in the middle, and you drink as you move along down and up and down the street. So this is something that was added late into this law and will be legal in the state of Ohio as well. Another fine idea from our General Assembly. Also, House Bill 14 is a powdered alcohol bill. There is, again, a contingency within the Ohio Senate. This is past the Ohio House. In the Senate, there's a contingency that thinks that if we would ban powdered alcohol, this would make us a nanny state, is what they keep saying, which, we need to be open to free enterprise, and, let's not be so concerned about this kind of stuff. And really what is needed now, we do need letters. We need, in June, there's going to be opportunities for testimony on this bill, and we need lots of people and lots of different folks. One of the things that was mentioned in House Bill 47 and why they passed that into law was they only had 2 people testify against the refreshment areas. So they really need to hear from folks across the state about powdered alcohol and the ban and why it is needed, so that they can actually see that this is something that folks, that legislators need to take seriously and get this thing passed. If we do not have public testimony in support of House Bill 14, which would ban powdered alcohol, we've been told that this will be a dead bill. So we have an opportunity to really make a difference here as far as the powdered alcohol. It's been approved at the federal level, should be coming into Ohio sometime this summer, and legislators need to hear from us, in public testimony. If you're not comfortable doing that, have someone, have community members from your area testify when it comes up. I will be sending something out. Like I said, the testimony will probably be in late June, maybe early July, after the budget is done, and then we need to go to action, create action on this and let folks know that this is the right thing to do. House Bill 33 is a medical marijuana bill. The language is about young, the children with epilepsy and seizure disorders getting getting some kind of cannabis-based medication. We have spoken to both of the sponsors of that bill, Rutherford and Rogers, and said that our concern is that if you want to do this, then these bills need to be based on science and not based on straight marijuana or whole plant medication. We have been pushing Epidiolex, which is a pharmaceutical grade compound. It is the cannabidiol compound taken from the marijuana plant and created by GW Pharmaceuticals. It's actually in the FDA process right now. We believe and we know that Epidiolex has about a 54% success rate. There's actually data that accompanies this drug, whereas there's another drug, Charlotte's Web, which is grown by a group called the Stanley Brothers from out in Colorado. And the Charlotte's Web does not have consistency in dosage. It doesn't have consistency in the amount that these kids are getting, often causing more seizures. And then also we don't have the data on whether it's working at all. We have anecdotal evidence from different families, but we have no real scientific data on whether this works at all. Epidiolex, again, goes back to that it actually is going through the FDA. It's being tested, it's being monitored. It has to go through some kind of research hospital or a doctor's care, and to not only make sure that the child's getting the correct dosage, but also whether it is interacting with other medications. What kind of seizure disorders does it have a more powerful impact on, and those types of things. So House Bill 33, we expect to be back at the forefront. The other piece that is interesting was there was a story in the Columbus Dispatch this morning that there are some legislators who would use this bill to have a very limited medical marijuana bill use this as the vehicle for that, which would what they want to do is they want to cut off Responsible Ohio, the legalization entity that is that's out there now that I'll talk a little bit more about in a second. So this is a constantly changing bill, or there might even be new legislation for a limited medical marijuana bill introduced. So we're closely monitoring that and actually meeting with some legislators today and later this week. So we will keep everyone updated on that. The marijuana update, since we are talking marijuana, Responsible Ohio has about 250,000 signatures collected in less than a month. They need 305,000 signatures verified by July 1st, and they're well on their way to getting this. They do have paid signature gatherers out there. Somewhere they're getting $3 to $4 a signature. So you can make a nice, collect 5,000 signatures. You can make yourself a nice $15,000 check. There's about 500 employees they have around the state, is what they're claiming. And got to debate Mr. Ian James, who is the campaign manager for Responsible Ohio, on what was it, Friday, I guess it was. And they're really pushing the medical piece of this, that they're doing this strictly for so that people can get compassionate care and can get their medical marijuana. As we know, this is nothing more than a cartel. This is nothing more than 10 individuals who want to get rich, from creating a legal marijuana market in the state of Ohio. They would own the market. The only way you could have marijuana is by buying it from these 10 individuals. I think it's an awful idea, and they want to put it in the Ohio Constitution. Some of the other talking points was the $120 million to spend on marijuana enforcement. They say they have a study done by the ACLU. I find those numbers to be exorbitant, simply for the fact that we are a decriminalized state, which means you can have 3.5 ounces, 100 grams, which is equal to about 170 joints or so. And you wouldn't be allowed, the most you can get is a $150 fine. So you're not talking about people being locked up, those types of things. Social justice is another piece he went after, that African Americans are locked up at a 4 times higher rate than white people for marijuana crimes. Well, frankly, there was a study done by the Drug Policy Alliance, which is actually an organization that would like to legalize all drugs, and their study found that in Colorado that marijuana legalization didn't help with the racial disparities in marijuana arrests at all, and they're about the same. We also have to keep in mind that racial disparity exists, pretty much across the board. For gambling, African Americans are arrested at 17 times a higher rate than whites. Murder, 7 times higher rate than whites. Rape is 6 times higher rate. So you have all of these issues that this is not a marijuana issue. This is a social justice issue, and something that needs to be addressed in communities and in other forms, and not just through a marijuana legalization act. That will not take care of any of the social justice issues. Also, they use that we're out. Alcohol prohibition didn't work, so we need to we're using the same talking points that we always have. So. Those were some of the talking points that some of the folks from Responsible Ohio were using, and we actually have tools that hopefully will be able to help folks out. So we have been talking about these for a while now. We are releasing the one-page sector sheets actually on Thursday, and we have electronic versions if people want to make their own and print them off and those types of things that we could release. We also are printing off a somewhat of a sizable amount of each of these sheets. But sheet one, what we wanted to do was create a sheet about marijuana and business concerns. Some of the examples are there. Marijuana may pose a litigation risk to employers, and it gives stats. And these are all cited stats and cited studies that we have on these sheets. So you'll on the front will be the stats and there's one, perfect. You can see the different things that the different stats that we have there, the different implications, and then on the back page of these are the citations you can see at the bottom. We left a lot of blank space. These are interchangeable here, or these are you can add stats and things on as we go along. So we'll be adding statistics and things like that as more information comes out. But this is a nice piece that you can leave with a business owner. You can take some of these stats and put them into presentations you're giving to entities, especially business organizations, and they can understand that this is not something that will not impact them. This is something that would definitely impact how they are running their business now. The second sheet is marijuana in the Colorado experiment. What we wanted to do there was to give folks an example, many examples about how things are working out in Colorado. There seems to be an awful lot of media hype that everything's going dandy out there. But some of the examples we used were the 149,000 of Colorado's adult residents use marijuana daily, which accounts for more than 2/3 of the marijuana sold out there, and also the drug-related suspensions and expulsions. Again, those are examples that we're using from those sheets, but there are many other examples that are on there. Going to sheet 3. We have marijuana and crime. So we have, fatal car crashes. It's also kind of a public safety document as well. So as you're talking about crime, public safety, again, there's the racial disparities piece that I talked about that I just spoke about. Again, these are cited pieces that are on these sheets. Sheet 4 is marijuana and mental health and learning. So you can, give this to your mental health organizations out there. Also, teachers, school officials, those types of folks. Use of marijuana in adolescents has been correlated with all of those. Suicidal ideation, certain personality disorders, interpersonal violence, college students. So you can use these with colleges and institutions of higher learning, and they regularly skip more classes, spend less time studying, had a higher dropout rate, those types of things. Sheet 5 is marijuana and more of a physical health. So as you're dealing with healthcare officials, healthcare administrators, those types of things, you have marijuana dependence, a stat about marijuana dependence, also about pregnancy and marijuana. Some of the newer marijuana ads that I've seen on Facebook and some of the social media sites actually say that it's safe to smoke marijuana while you're pregnant. There's been quite a few stats that have shown otherwise, so that will help with that as well. There's a big misconception about that. Also, marijuana and youth. So marijuana and young people, again, goes back to a lot of the issues that they have with mental health issues, school and unemployment and all of those types of things. So as you're, a parent trying to raise a young person, this is not something you want to have happen to your life. And then finally, the seventh sheet is marijuana in Ohio. It actually gives stats about Responsible Ohio. We don't name the organization, but we do kind of give, we do give stats on how this would look if passed in Ohio. So, people using marijuana for medicinal purposes would be allowed to use marijuana in public, in schools, daycares, any other open area. And also, there would be 1,159 pot shops. Comparatively, there are only 203 Starbucks around the state of Ohio. So that really focuses on the ballot initiative that we have in Ohio. Those are free to individuals. We're going to put them under the SPECA Member Center. However, if you would like, you're not a member of SPECA or someone in your on your coalition, law enforcement or business, or whoever else would like those. Let us know. We can send those out to folks. Like I said, we have a number of actually printed copies of each of those, but you might just want to print those off yourself and start handing them out. And again, the ones that we will have on the website will be continually updated with new stats and new pieces that will be cited and things like that. Other marijuana news. Hamilton County Prosecutor Joe Dieters actually came out and said that he would like to create a task force to study marijuana legalization. He basically said that, well, Responsible Ohio is the one who urged this of him, and he is agreeing with what they're doing. So that was kind of disturbing to us. At the same time, Representative Mike Curtin, a Democrat from here in Franklin County, wants to create legislation to stop Responsible Ohio and any other monopoly organization from getting into the Ohio Constitution. He doesn't think that is right, so he's looking for other co-signers. It might be a good idea to contact your legislator to say, hey, contact Representative Curtin and sign on to that. This is not going to be good for Ohio, whether you even agree with legalization or not. Responsible Ohio is not the way to do this, by putting a legalized cartel basically into our Ohio Constitution, and they're protected from they're a protected entity that would then run the entire marijuana industry in Ohio. Also, just an interesting story that just came out yesterday. Emory University, the Emory-Rollins School of Public Health, had a study that showed that medical marijuana states have higher rates of marijuana abuse and marijuana dependence. They have a 18% higher rate, and these are adults. None of the study focused on young people. And they actually have higher binge drinking rates among adults too, about 10% higher than non-medical marijuana states. So this is just an interesting new study and kind of a new stat that you can use out there. I posted it on our social media this morning. So if you want to forward that, you want to use that, the link to the story is on Facebook, or I can send it to you. So I know we have about 5 more minutes, so I didn't know if there were any questions or any kind of things that people wanted to announce. I would open that up to individuals.
And the first question is from Fran, and her question is, would you have a template or a letter that we could use to encourage our local representatives to join Representative Curtin?
That is a great suggestion, and actually we'll create something and send that out to folks as well. So that's a great suggestion, Fran. So it will be something short and sweet, and it'll be done after we talk to Representative Antonio today about hopefully signing on as well. So great suggestion.
And does anyone else have questions? We don't see any being submitted so far. If you do have a question, please submit that into the questions section of the GoToWebinar navigation panel. This question from Tony: is there any more information on Better for Ohio?
Yeah, Better for Ohio is another legalization entity that wants to create. They actually admit that they took the language from Responsible Ohio, and what they are is they're starting to collect signatures as well. They have passed the Attorney General's approval, not approval of the scheme, but he has kind of a formality that it has to match. The summary has to match the written language, and this is an interesting one. It's kind of quirky, and to me a little bit silly, but they would create 40 marijuana farms across the state, and people whoever the creator of this is, he was a former Libertarian governor candidate. He has 40 $100 bills, and if you and somehow these are dispersed out, I'm guessing people buy these $100 bills, and the serial number will actually be put into the serial number of these 40 $100 bills will be put into the Constitution of Ohio. And folks would be given these $100 bills, and then there would be 10 large marijuana farms and 30 small ones, and they would own those. So it's kind of again, much of the same language as Responsible Ohio is what is in Better for Ohio. It's just they've added this 40 $100 bills language, which is again kind of quirky and odd. So.
And the next question, is it true that there is language in the legislation to release past drug offenders if marijuana is legalized?
That is something that Responsible Ohio has claimed that they want to do afterwards. It is not in the language right now, but they do want to expunge records. There's another one called Ohio Instant Prohibition, which is also collecting signatures. That language says that past drug offenders would be expunged. Actually, what's interesting is when I debated Responsible Ohio, the Ohio Instant Prohibition came up and asked to partner with us because, according to them, we have a common enemy, and it is Responsible Ohio. So, but they're the ones with the language about expungement of records.
And this is a statement from Chelsea. Her coalition has formed an ad hoc committee on marijuana legalization for our community. We will be looking into what kind of restrictions we can put into the city limits for dispensaries. I encourage other coalitions to do similar things. If we wait until after it becomes legalized, we will be too late. And Chelsea, I think that's something that we can look to and have gotten a lot of feedback from Michigan because they kept saying, well, it will never pass here until it did. So that's a wonderful comment. And then this question from Tonda. Could you remind listeners where they can download the personal form to fill out and sign against alcohol?
Yes, that is again in our SPECA member center. There's talking points and signature form that you're against the powdered alcohol and the support of House Bill 14. So go under our SPECA pages and you'll be able to find that there.
Tony answered the question faster than my fingers could type. That is all the questions that we have right now. We do have 2 more minutes. If anyone has any other burning things to either ask or to talk about what they're doing in their community. This is really an interesting time as we look at so many different groups popping up throughout Ohio and also looking at what's happening nationally with the quote-unquote Colorado experiment and how that's not working out so well. So it appears that there are no other questions at this time. If there's something that pops into your head post-call, feel free to contact Tony here at 614-540-9985, extension 17, or tcoder at drugfreeactionalliance.org. And we hope that you'll join us this afternoon for our third in our 3-part webinar series on environmental prevention strategies. This will be focused on marijuana, and we'll talk about some local ordinances and some other things that you can do. and you can register from right on our calendar page at drugfreeactionalliance.org. Thank you again for everyone joining us today. Hopefully the weather will stay nice and cool and calm for us all, and we'll look forward to chatting with you next month. Have a great month, everyone.